Using a phrase like "you're not allowed" is completely inappropriate in maternity care, but sadly it's used all the time to stop women from making the decisions that they want to make.
I endeavoured to have a natural vaginal delivery, but unfortunately when that wasn't possible, I wasn't given the choice to have a caesarean, and I was actually forced into a forceps procedure against my will. It was absolutely under duress. It was pretty obvious that it was under duress because I cried all the way through.
Birth is an amazing experience for women, but actually when women are giving birth they're extremely vulnerable, and it's a time when they can be inadvertently mistreated by staff.
When I first met the consultant who came on the new shift at 8 o'clock, initially I felt, she was reasonably professional, but as soon as I started talking about how I felt and how I wanted to be involved in the decision that was made regarding delivery, I felt she actually looked at me with contempt. From everything that I'd read, I thought, well, if forceps or a vacuum delivery didn't work, we'd end up in a caesarean anyway. So I'd rather expose myself and my child to one set of risks rather than the possibility of two sets of risks. At no stage did I want forceps to be used, and I did say no on a number of occasions. After very politely declining on so many occasions, the consultant told me that my baby's heart rate had dropped, she needed to act immediately, and she wanted to use forceps and nothing else. Obviously, I'm not a medical professional, and when somebody says that to me, and I have said no, no, no all the way through, it did get to the stage where it felt like it was critical, and the only answer that would be acceptable was yes. So at that stage, in those circumstances, I felt I had no choice because I basically wasn't being listened to.
You may think that you have a woman's best interests at heart by pressuring them to accept medical care that they don't want, or dissuading them from having the kind of medical care they do want, but this constitutes bullying. Women can feel threatened and scared and stop engaging with us as healthcare professionals.
When it got to the fourth pull, and I knew, the words were clear, 1 pull, and so we'd got to 4, and in my mind as well, I did know that the NICE guidelines were 3 and no more. My husband jumped up and said, this, what is going on? This is not what we agreed to.
In 2012, the NHS Ombudsman investigated a case in which a woman was bullied into taking antibiotics during her labour by the hospital, who threatened to call social services if she didn't take the drugs. The NHS Ombudsman strongly criticised the trust, and the case shows that it's completely inappropriate to use the threat of social services to bully women into accepting any particular medical intervention. Social services referrals should only be made when the health professional believes that there's a risk of significant harm to the baby after it is born. Social services referrals should never be made just because the woman's decision about what is best for her and her baby differs from that of the clinical team caring for her.
I asked her why she'd gone ahead with the forceps procedure when I'd made it very clear, both verbally and in my birth plan, that I wasn't happy with that. She almost seemed flabbergasted. She said to me, doctors and patients are not equal. What kind of system would we have if we allowed patients to make decisions about their healthcare? That would be like saying doctors and patients are equal.
So a birth plan is a fantastic document for women to use to get an idea of what sort of care they do want and don't want. It's got no legal binding to it, but actually it's a really good tool for women and their birth carers to use to ensure that they get the sort of care that they want and that they're involved in all the decisions that they need to make.
It's devastated me. It's something that I've had to come to terms with because it's not going to go away. I look at my son and I see the scars, and I know exactly where that came from, where I was put in a vulnerable position, and the doctor should have had mine and my son's best interests at heart, but apparently her motivation was something to do with the status of doctors and patients, and that is actually, very painful for me.
First and foremost, we need to listen to women and understand what they're asking for and what their concerns are. Our responsibility as clinicians is to explain our recommendations and to explain what the risks and benefits of that recommendation might be, and also to explain any alternatives and certainly to be able to answer the woman's questions in full. It's really important that the woman is giving fully informed consent when you're offering an intervention.
So we know how hard it can be for midwives and doctors when you're faced with the challenges of women that are asking for things that are outside of the norm. But if you've had a really good discussion with women and you've gone through all the pros and cons, and a woman makes a choice and you support that woman's choice, the law will support you. There's nothing to be afraid of. The law's on your side.
The National Maternity Review set out a vision of personalised maternity care as the best way of achieving safety in childbirth. We wholeheartedly agree with this. Women shouldn't have to fit into the system. The system should be made to suit their needs and their decisions.